Welcome to Government Speak. This is where we'll cut through the government speak to get the information you need about county programs, services, and events straight from the source. Welcome to Government Speak, Contra Costa County's official podcast. I'm your host, Kristi Jourdan, Contra Costa County's Public Information Officer. And on this episode, we have Health Officer Dr. Ori Tzvieli joining us in studio at 10 Douglas. Dr. Ori, welcome.
Thank you for having me.
So 'tis the season for a runny nose and coughing and congestion and all of that fun. What better way to give a gift than the gift of information as we head into the holiday season? What are some of the types of respiratory viruses that we need to be aware of?
You know, there's a million respiratory viruses, but the big three that everyone sort of hears about and knows about are COVID, obviously COVID-19, flu virus, and RSV. So those are the three that as we get closer to the end of fall, beginning of winter, and early spring, that we see a lot more cases of those three, viruses causing infections.
So with that trifecta of COVID, flu, and RSV, I know that I have fun in my household playing the game of is it COVID or is it a cold? How can people protect themselves from these viruses?
Probably the best way to protect yourself is to get up to date on your vaccine. So the RSV vaccine is not recommended for everyone. That's the easiest one. It's recommended for certain populations, particularly premature infants, and then older people, everyone over 75, and then people over 60 who have high risk conditions should get that. And that's just a once in your lifetime vaccination. The CDC is still trying to suss out whether we should get boosters or not, but for the moment, it's just a one-time vaccine. Also for pregnant women, because they can, they develop immunity to it and they can pass it on to their babies in utero through the placenta. So pregnant women between 32 and 36 weeks of pregnancy. The other two vaccines for COVID and for flu are seasonal vaccines. So they update them every year and they look to see what are the strains that are circulating out there, and then they will update the vaccine. So for both of those, I really recommend getting the updated vaccine if you didn't get one this year. Even if they don't give you 100% foolproof protection, they will make it so that when you do get the disease, you will not get as sick and, most importantly, be less likely to die. So particularly if you're older, if you have any sort of immune compromise or other chronic medical conditions, it's a great idea to get the vaccine. The other things you can do to protect yourself is if you're in crowded indoor situations, you can wear a mask. The best ones are the N95 or KN95 masks. They do help. They reduce your chance of catching viruses from one of the many other people in that crowded indoor setting. And the other thing that people are always thinking, like, how can I not get sick? The other thing I want people to think about is how can I not get other people sick? So if you're sick, if you have cold symptoms, if you have a runny nose, sneezing, coughing, fever, muscle aches, don't go out in public. So that's a big deal, and I think COVID has taught a lot of us to be more considerate of those of us who may be more immunocompromised or maybe more medically vulnerable. So it's just a good idea. If you have symptoms, stay home and rest.
So you talked about vaccines being a good protection against these viruses. I just got my COVID shot and my flu shot a couple of weeks ago. How do they protect against variants? It seems like we get information about these viruses and then suddenly they're mutating into something else. So, how effective are vaccines against the variants?
It's a great question. Parts of the virus, each virus is a little different, but the general principle is part of the virus mutates and parts of it stay the same. So, and even when it mutates, that means it's like a little different from before, but not necessarily a lot different from before. So even if the vaccine is not a perfect match, it will still give you a good enough protection. Your immune system, it primes your immune system to recognize like, oh, this sort of looks like the virus and suspicious. I'm ready with some antibodies and I'm going to be able to fight this off to the point where you might not even feel sick. That's what the vaccines are doing. So with flu, each year they put 3 different strains of the virus in the vaccine. They're trying to guess which 3 will be out there because flu has a predictable spread pattern. It goes up from it comes up to us from Latin America when their winter is our summer, and then the virus sort of migrates up here with travelers and hits during our winter. So they looked like what's going on in Argentina last July, and then they make the flu vaccine. Hopefully, some of those same strains will be what comes up here in our winter. And then some years they get the guess right, and some years it's not as good. So most of the time it's about 50, on a good year, 60 or 70% protection from a flu vaccine. So, hey, I don't know about you, but getting flu is a miserable experience. So even I will take even some reduction, even if it's not perfect reduction.
So what about testing? I go through the checkout and I see the COVID at-home tests. I could pick those up while I'm, scanning my groceries. How reliable or effective are they, especially when we see in the news about, the dates, if they're still in use or if they're too old to be used at that point?
Yeah, it's a good question. Generally, the tests are pretty good. They're not perfect, and, no test is 100%. But I would say, 80, 90%, in the test, they generally try to identify the part of the virus that stays the same, that doesn't mutate very much. So it's pretty good. What happens is your body, once it gets infected with a virus, it makes lots of copies of the virus. And the number of copies needs to be a certain level for the test to turn positive. So sometimes people are just starting to get sick and they test and it's negative, and then they test the next day and it's positive. So I would say the COVID tests are pretty good. There's not like a wide distribution of flu or RSV tests out there yet. We think one day there will be. But for now, I would trust the COVID tests that are out there. But if you're early in your symptoms, you might want to test again like a day or two later, just in case it was too early to test the first time. The expiration dates, I don't want to speak out of turn, but generally I think they last. They kept extending them during the pandemic, and I think they generally last much longer than the expiration date on the package says. So I personally would probably use an expired one if that's all I had sitting around, but obviously one that isn't expired is better.
That's all good information to have, and it's amazing to me the imperfections of science and how you're just kind of relying on information to make the best decisions for yourself and your loved ones when it comes to your health. You talked about masks also being a way to protect against the viruses and also to help keep other people around you safe. How effective are masks? You mentioned KN95s and N95s. Beyond that, what's the current guidance right now for masks?
Masks are not required by the general public. We do have a health order in Contra, Costa that we issued to require staff in healthcare facilities where the most vulnerable patients are. So the staff there have to wear masks when they're face-to-face with the patient. So like hospitals, nursing homes, places where, grandma or grandpa might be. And you really certainly don't want one of the hospital staffers to bring them COVID and get them sick. So we're trying to reduce that. We know they're somewhat effective. There's multiple studies that show that, but we don't know exactly how much. So because the data is not perfect, we chose to be more cautious with those most vulnerable. I think personally, I don't go around wearing a mask everywhere, but if I'm in a really crowded place, I do. And then if I was immune compromised or very elderly, I would choose to probably wear one if I was worried about getting sick. COVID is no joke. Over 1 million Americans died of COVID during the pandemic. And especially if you're older, if you have comorbidities, if you have immune compromise, you do what you can to protect yourself. And obviously for each one of us, it's an individual choice, right? Like sometimes there's value in having people see your face or seeing someone else's face. So it is a decision. We're lucky that we're in a country where we get to decide that most of the time, except for very extreme circumstances. But I think so it's an individual decision, but it is probably offering some degree of protection.
And the health order that you mentioned, that wasn't just specific to Contra Costa County, correct? That was in alignment with other
That's
areas.
right. Almost all the counties in the Bay Area issued a similar order. So most of the Bay Area population is covered by something similar. The population's a little different. Some places focused on nursing homes. Like some of the other counties, we chose to focus on the highest risk settings. So hospitals, nursing homes, dialysis centers are the main settings where it's effective.
So we also sometimes hear that COVID rates are spiking. How do you know if there's more COVID infections in the community, and how does kind of the wastewater testing come into play with that?
Oh, yeah, I'm glad you mentioned that. So wastewater testing is a cool new thing to tell us how much COVID is circulating out there. We're lucky that we still have funding from the federal government and state government to test wastewater systems in our county. So we test East County, we test Central San, and we test West County Sanitation District. And if you go on our website at cchealth.org, you can actually click on the link, and it shows you where things are right now. So right now, levels are actually low. They were pretty high in the summer, and we expect them to get higher in the winter. But right now, levels are on the low end relatively and sort of plateauing, so they're not going up or going down significantly. I just looked right before I came over here. And so anyone who wants to check can go over there. It's not perfect. There are fluctuations, but it can tell you the general trend. So that's nice. And, it came into widespread use during the COVID pandemic, but we now have some wastewater testing for some of the other diseases out there, and some counties are even testing for opioid levels in the wastewater. There's a lot of stuff that you can use wastewater testing for, and I think that's a developing aspect of public health.
That's a pretty amazing use of technology, too, to help inform whether it's decisions around resources coming in to address some of these issues. So it's amazing that we have that technology in our community. Are there any trends that we're seeing as it relates to any of these viruses, particularly with COVID?
What we've seen in the last few years is COVID tends to have a peak in the summer and a peak in the winter. We're not sure exactly why that is. There's a lot of people think it's related to the weather. So when it's hot, people stay indoors, and there's more indoor gatherings. And when it's really cold, people stay indoors more. And people gather for holidays and family get-togethers during both of those time periods. So there's probably a little more transmission. That's been the trend. Long-term, COVID is a coronavirus, and most coronaviruses, after a period of time, tend to be winter viruses. So we expect that in the future, it will probably be higher numbers in the winter, but we don't know exactly when that shift will happen.
We already have a lot of information in the past 4 years, I'm sure, and a lot of change and evolution in this discussion. So I'm sure there's more to come.
Yeah, and we're learning so much still.
Beyond the viruses that we're talking about now, we've seen in the headlines recently the avian flu, the bird flu, H5N1. What is it? Should we be concerned? Is it here in our county, and is it impacting humans?
It's a great question. H5N1 is one of many kinds of flu viruses. Flu affects not just human beings, it affects birds, it affects cows, it affects sheep, ferrets, many, many animals. So H5N1 it's called a bird flu, but it actually, we know that it's also affecting cows, goats, several animal species, and so far, we have not had a case in Contra Costa County. There have been about 50 cases in California, and they're almost all in either people who work directly with cows or directly with poultry, so agricultural workers who are exposed to infected animals. The cases in the United States of H5N1 have been relatively mild. Mostly they cause like a pink eye type of syndrome, sometimes with fever and sneezing, but generally mild. And the good news is there has not been human-to-human transmission that we know about. So people have caught it from the animal, usually agricultural workers that work directly with the animals, but they haven't been passing it on to their families or loved ones, people they're close to, which is great. What we worry about is one day in the future, the virus will mutate and then will become more transmissible human to human. And that's why we're keeping a close eye on it. We haven't seen that yet, so that's lucky. There are some medicines to treat it. If you get, H5N1 flu, nobody's gotten it yet. I think the risk to the general population is very low, but it's something that is in the news. We're keeping an eye on it. The cows do get sick. They do secrete it in their milk, but when you buy milk at the store, most of the time you're buying pasteurized milk, and the pasteurization is like a heating of the milk that kills most of the bugs in it. It does kill the H5N1 virus. So drinking pasteurized milk is generally safer than drinking raw milk if that's what you're worried about. There's some people that think there's health benefits to raw milk for other reasons. But in general, right now, when we know we have infected dairy herds in California, I would recommend drinking pasteurized milk if you're a milk drinker.
Beyond all of the information that we've covered, you've also spent 25 years with the county. This is something, you started in a residency program, correct?
That's right. I came here for residency right out of medical school. I did my medical school at UCSF, and then I came here as a family medicine resident back in the year 2000. So this is my 25th year here. And I actually was here back even before that as a medical student. I did a 1-month rotation here in Contra Costa. And then after I did my residency, I just stayed here. So this has been my only adult job for all these years. I've had different roles in the health department. I used to teach the residents, and I was a hospitalist for 10 years, taking care of sick people in the hospital. I had my primary care practice out of the Concord Health Center. I had to give that up during COVID because things got a little busy, but I really love being a primary care doctor, and I still see patients a half a day a week in the Pittsburgh Health Center. So that's fun, and it keeps you honest to see patients in the real world. So I'm happy to do the combination of direct patient care and also the health officer or public health director work within Contra Costa Health.
So 25 years, what keeps you coming back? And what is it about this community that keeps you coming back?
I love Contra Costa. I feel like it's a really real place. It's really practical. I feel like the people are just wonderful. The communities really take care of each other. And here in Contra Costa, we have done that. It was great during the pandemic to see different parts of the county workforce come together. We had everyone pitching in towards a common goal of keeping the community healthy. So, really environmental health people, librarians, police, firefighters, everyone in the hospital and clinics, in the public health department, in the media offices, everyone came together. And so the staff and personnel who work for the county are great, but also all the people. I feel like I got to talk to many community groups, elder groups, people in Rossmore, people in supportive housing, homeless folks, and people with mental health challenges, and so many parts of our community. We had a wonderfully supportive board that really asked tough questions, but really supported the community in getting healthier. We got vaccines out. We were one of the first counties in the Bay Area to get vaccines out to the community. And when you look at large counties that have over 1 million people, Contra Costa and Alameda County rank number 1 or 2 or 2 and 1 in the nation in how well we did during our COVID response, meaning how many fewer people died because of the response of our community, of our health departments, and everyone else who chipped in. So I just love being here. I can't imagine working anywhere else. I think I'll be here until I retire, and I hope to at least. And I really appreciate. I feel like I've gotten to know the community really well over the years, and I also love that. I sort of used the word practical earlier. That people are just making common sense decisions here, and we do have our politics and we have our polarization, but I feel like we come together around common goals in a very practical way, and that's at every level of the community, of the workforce, of our elected officials. So I really love it here.
Well, you've painted a very accurate picture and a wonderful picture of Contra Costa County in 25 years of work here. Hopefully it'll be 25 more. Mm-hmm. We've covered a lot of information for folks today. If there's one takeaway from the discussion, what would you want people listening to remember the most?
I would probably say I would say two things. I know you wanted one, but I'm going to say two. One is get your up-to-date vaccine, every year for COVID and flu, and if you're higher risk, the RSV one also. Talk to your healthcare provider if you're not sure if you need to or not. So that's the first thing. And the second thing is something that I really learned during the pandemic is that we are one community. We're all intertwined in a million different ways. We're in each other's houses, not literally, but the viruses are transmitted, every part of our community we go, stores, homes, nursing homes, hospitals. And so just remember that to care for one another, to support one another, to think about your impact in the community, how you can help, their impact on you. And to remember that interconnectedness, I think it is something that takes us away from polarization and brings us together to do what's right.
What a lovely way to end that. Thank you for being here, Dr. Ori. And that's it for today's show. I'm your host, Kristi Jourdan, Contra Costa County's Public Information Officer. Thanks for joining us on Government Speak, brought to you by the Office of Communications and Media. But don't just take our word for it. Stay curious, stay connected, and stay informed. Until next time, keep your mind open and your facts straight.